long answer question of the tongue, the examiner usually asks the student to describe the tongue, its development, anatomy, nerve supply, and the lymphatic drainage. So you would be starting the answer by giving a brief introduction of the tongue. So you can write that tongue is a muscular organ situated in the floor of the mouth and its functions. Then you can write the different parts of the tongue and the information that I've highlighted. That is, a tongue has a root, tip, a body. Body of the tongue again has a curved upper surface or the dorsum and an inferior surface. You can mention that the root is attached to the styloid process and the soft palate above and to the mandible below. Then you can mention about the dorsum of the tongue. The dorsum of the tongue is again divided into two parts, an oral part and a pharyngeal part. That is separated by a faint V-shaped groove that is called the sulcus terminalis. Then you can describe about the oral or the papillary part of the tongue, which is placed on the floor of the mouth, and the superior surface of the oral part shows a median furrow and it is covered with papillae, which makes it rough. The inferior surface is covered with a smooth mucous membrane which shows a median fold called the frenulum linguae. So basically in your answer, the points that I have highlighted are the main points that you have to mention in your long answer questions. This is an easy diagram and you should draw the diagram. The diagram shows the foramen cecum, the different papillae of the tongue, the lymphoid follicles, and the palatine tonsil. This is the dorsum of the tongue. The below diagram, it shows the inferior surface of the tongue. So you can draw this diagram and mention about the deep lingual vein, frenulum, and pila fimbriae. Next comes the papillae of the tongue. So first give the brief introduction of the tongue, write about the oral and the pharyngeal part, and you can write that the pharyngeal part or the lymphoid part of the tongue lies behind the palatoglossal arches and the sulcus terminalis. The posterior most part of the tongue is connected to the epiglottis by a threefold of mucous membrane. So this is the introduction of the tongue. Now we move on to the papillae of the tongue. So the papillae of the tongue are divided as what? The circumvallate papillae, largest in size, 8 to 12 in number. They are situated immediately in the front of the sulcus terminalis. Then comes the fungiform papillae. They are the most numerous near the tip and margins of the tongue, but some of them are also scattered over the dorsum. Each papillae has a narrow pedicel and a large rounded head. They are distinguished by the bright red color. Then comes the filiform papillae or the conical papillae that cover the presulcal area of the dorsum of the tongue and give it a characteristic velvety appearance. So first write the introduction of the tongue, different parts of the tongue, and then the papilla of the tongue. I have also made a MCQ video about the different papillas of the tongue. You can also go through that video. Next, we have to mention about the muscles of the tongue. So, the muscles of the tongue are divided as the intrinsic muscle and the extrinsic muscle. Intrinsic muscle are superior longitudinal, inferior longitudinal, transverse, and the vertical. The intrinsic muscle, they occupy the upper part of the tongue and are attached to the submucous fibrous layer and to the median fibrous septum. They alter the shape of the tongue. That is the intrinsic muscles. The extrinsic muscles are again divided into four, that is the genioglossus, hypoglossus, styloglossus, and the palatoglossus. The extrinsic muscle connects the tongue to the mandible via genioglossus, to the higher bone through hypoglossus, to the styloid process via styloglossus, and to the palate via palatoglossus. It is basically the terms. Genioglossus means and connects the muscle connects the tongue to the mandible. Hyoglossus, hyoid bone. Styloglossus, styloid. Palatoglossus is the palate. So in this way, you can remember the different extrinsic muscles of the tongue and what do they connect. In the intrinsic muscle, it is a superior longitudinal, inferior longitudinal, transverse, and the vertical. And then you can mention that the inferior longitudinal is the narrow band lying close to the inferior surface of the tongue. The vertical muscle is found at the border of the anterior part of the tongue. So we'll come to the diagram and the table. What you have to mention in your answer. You can make this table. So it shows the different extrinsic muscles of the tongue, their origin. As the name suggests, palatoglossus means its origin is from the palatine aponeurosis. Hyoglossus, whole length of greater corona and the lateral part of the hyoid bone. Styloglossus, styloid process. Genioglossus, genial tubercle of the mandible. This is their origin. Insertion, you have to learn where does the each extrinsic muscle inserts and their action. Even if you draw this table, it will fetch you more marks. Then you can write the summary of the actions of the muscle. So instead of writing it in a paragraph form, you can just make a table of the extrinsic muscles of the tongue, followed by a summary of the action of the muscles. That is intrinsic muscles and their actions, and extrinsic muscle and their actions. Only styloglossus retracts the tongue. Palatoglossus elevates the tongue. Hyoglossus depresses the tongue. Genioglossus protrudes the tongue. So you can remember it by GP, that is a gutta percha. GP, genioglossus protrudes the tongue. Hyoglossus depresses, HD quality, so HD. And that way you can remember the actions of the genioglossus and hyoglossus. Now we move on to the action of the intrinsic muscle, that is a superior longitudinal, inferior longitudinal, transverse and vertical. Both the longitudinal muscle will shorten the tongue, but the superior longitudinal makes it dorsum concave, inferior longitudinal makes its dorsum convex. This is the differentiating action between the superior longitudinal and the inferior one. Transverse, as the name suggests, makes the tongue narrow and elongated. When the tongue is narrow, you will see that the tongue gets elongated. Vertical is just the opposite. It will make the tongue broad and flattened. So you can mention in your exams after introduction different papilla of the tongue. You can have the muscles, intrinsic, extrinsic, write the 4 names of the muscle, draw both the tables, one origin, insertion and the actions of the extrinsic muscle and the actions of the intrinsic muscle. This diagram is easy. It looks difficult, but it is not difficult. This diagram is a transverse, it's just a coronal section, it is a coronal section of the tongue. So what is a coronal section? It will divide into a front and a back part, that is anterior and a posterior. So over here, first we'll start with the easy muscles. This is a transverse muscle. This is a transverse muscle. You can show vertical, as the name suggests, this is a vertical muscle. So vertical and transverse muscles are done. The one over here that is present near to the tongue, that is your inferior longitudinal muscle, and over here this is a superior longitudinal muscle. So your 4 muscles, that is the intrinsic muscles, are done: superior longitudinal, vertical, transverse and inferior longitudinal. Over here, this is the greater corona of hyoid. So this muscle will be your hyoglossus muscle. Over here, this larger muscle is your genioglossus muscle. And next to the hyoglossus is your styloglossus muscle. So this diagram, it looks difficult, but it is not difficult. Now, after writing about the muscles, we'll move to the supply, that is the arterial supply and the venous supply of the tongue. So the arterial supply is derived from the lingual artery, which is a branch of the external carotid artery. That is a main point that you have to remember. Arterial supply of the tongue is from the lingual artery. The root of the tongue is also supplied by tonsillar artery and a branch of a facial artery, and ascending pharyngeal branch of the external carotid. So mainly the supply of the tongue is to the external carotid artery. One of the branches is the lingual artery. Also, the root of the tongue is supplied by the tonsillar artery. That is all about the arterial supply of the tongue. The venous drainage of the tongue. So 2 vena comitants accompany the lingual artery, and 1 vena comitant accompanies the hypoglossal nerve. The deep lingual nerve is the largest and the principal vein of the tongue. In case of artery, it was the lingual artery, which is the main branch and that supplies the tongue. In case of venous drainage, it is the deep lingual vein, which is the largest and the principal vein of the tongue. Now we move on to the lymphatic drainage. This is also very important, and sometimes in the MCQs also they ask you about the different lymphatic drainages of the tongue. So the tip of the tongue drains to the submental nodes. That only the tip drains to the submental. The right and the left halves of the remaining part of the anterior 2/3 of the tongue, they drain unilaterally to the submandibular nodes. Tip of the tongue bilaterally to the submental. You can see in this diagram, the right and the left half of the anterior 2/3 of the tongue, they drain unilaterally onto the submandibular nodes. The posterior most and the posterior 1/3 of the tongue, they drain bilaterally into the upper deep cervical lymph nodes, including the jugulo-digastric nodes. This portion of the tongue, they drain into the deep cervical groove, that including the jugulo-digastric node. The whole lymph, that is all these lymphs together, they drain into jugulo-omohyoid nodes. These are also known as the lymph nodes of the tongue. So see, a simple way, the tongue, it stands for TONGUE. So T is for tongue, O is for jugulo-omohyoid, that is O. So you can just remember in that way. So the tip of the tongue is submental, The anterior two-third right and the left halves, they drain into submandibular. Posterior most and the posterior part into the deep cervical group. The whole of the tongue drains into jugulo-omohyoid nose. Now, to make the examiner understand that you even have the practical knowledge and the clinical anatomy of the tongue, you know it well. You can write that genioglossus is the safety muscle of the tongue, and genioglossus is the only muscle of the tongue which protrudes its forward. It is used for testing the integrity of the hypoglossal nerve. That is it. Now we move on to the nerve supply of the tongue. So every organ has a sensory and a motor supply. First we'll start with the motor supply. All intrinsic and extrinsic muscle except the palatoglossus, they are supplied by the hypoglossal nerve, which is the 12th cranial nerve. So there are total 8, 4 intrinsic, 4 extrinsic. All the muscles are supplied by the hypoglossal nerve except for the palatoglossus, which is supplied by the cranial root of the accessory nerve through the pharyngeal plexus. That is about the motor supply of the tongue. Now we move on to the sensory supply. The lingual nerve is the nerve of general sensation and chorda tympani is the nerve of taste for the anterior two-thirds of the tongue, except valid papillae, except for the circumvalid papillae. The glossopharyngeal nerve is the nerve for both general sensation and taste for the posterior one-third of the tongue, including the circumvalid papillae. The posterior most part of the tongue is supplied by the vagus nerve. See, the nerve supply of the tongue, it is motor and sensory. All the muscles of the tongue except palatoglossus are supplied by the hypoglossal nerve. Palatoglossus is supplied by the cranial root of the accessory nerve. The motor supply is done. Now sensory supply is again divided into the anterior part, posterior one-third and the posterior most. So in the anterior two-thirds of the tongue, lingual nerve is for general sensation and chorda tympani is the nerve for taste, except the circumvalid papillae. In the posterior one-third of the tongue, the glossopharyngeal nerve is the nerve for both general sensation and taste. In the posterior most part of the tongue, it is supplied through vagus nerve. So, to summarize, we can say the nerve supply of the tongue is through 7, 9, 10 and 12 cranial nerves. 7 being the facial, 9th is the glossopharyngeal, 10th is the vagus and 12th is the hypoglossal nerve. Sometimes in your MCQ they ask, which of the following cranial nerve does not supply to the tongue? So 7, 9, 10 and 12 have their supply to the tongue. So this is about the nervous supply of the tongue. Now we move on to this diagram. So this diagram shows you the nerve supply of the tongue. So over here you can see the general sensation by lingual and taste by chorda tympani, that is the anterior two-third of the tongue. 7 muscles of the tongue supplied by the hypoglossal nerve. Only palatoglossus supplied by the vago-accessory complex. So you can draw this, it's a very easy, you just have to draw the tongue divided into the anterior, posterior and the posterior most part and then just write. So that even your answer will be bigger enough and the examiner will be happy to see that you're drawing so many diagrams. Then you have to show for the posterior two-third, both general and taste sensation are by the glossopharyngeal nerve. Posterior most, both general and taste sensations are by the vagus nerve. So this was about a nervous supply. If you want, you can draw this diagram showing the different action, that this is the retraction, elevation, depression and protrusion of the tongue. That is the action of the extrinsic muscles of the tongue. Over here, it shows the effect of paralysis of the right 12th nerve, that is the hypoglossal nerve. So what happens when there is paralysis of the hypoglossal nerve? The tip of the tongue gets deviated to the paralyzed side. That is, if you have paralysis of the right hypoglossal nerve, it will get deviated to the left side. So after your nervous supply, arterial and venous supply is done, we move on to the last part, that is the development of the tongue. The anterior two-third, that is from two lingual swellings which arises from the first branchial arch. That is, your anterior two-third is from your first arch. Posterior one-third is from your third arch. And the posterior most part is from your fourth arch, because in the third arch there is a nervous supply, that is a glossopharyngeal nerve. So this is what you will have to write. So in your MCQs they ask you, and which arch does not help in the development of the tongue? Now anterior two-third is from the first arch, posterior one-third is from the third arch and the posterior most is from the fourth arch. And then we move on to the muscles. The muscles of the tongue, they develop from the occipital myotome. They ask you in your MCQ, the muscles of the tongue develop from where? Occipital, myotomes. Then we move on to the taste part. The taste from the anterior two-thirds of the tongue, except for the valid papillae, is by chorda tympani. We already had learned this in the nervous supply. Taste from the posterior one-third of the tongue, including the valid papillae, is carried by the cranial nerves, ninth cranial nerve, that is a glossopharyngeal nerve. And the taste from the posterior most part of the tongue and the epiglottis, they travel to the vagus. So you can just make a different subheading like a taste pathway, but the points are same like a nervous supply of the tongue. With this, we complete the long answer question of the tongue. So what are the key points that you need to write? First is the introduction of the tongue, different parts of the tongue, papilla of the tongue, extrinsic and intrinsic muscles. Make the diagram, draw the table of intrinsic muscles, draw the table for the action of the extrinsic muscles, write the origin and insertion of the extrinsic muscles, then move on to the nervous supply of the tongue, motor and sensory, then the arterial supply of the tongue, venous supply of the tongue, development of the tongue like anterior, posterior most, they develop from which arch. Then muscles of the tongue, they develop from occipital myotomes, and then a small heading of the taste part in which you just have to write the nervous supply. Over here, we'll just quickly solve 5 MCQs. Epithelium of the tongue develops from all arches except second arch. First arch is your anterior two-thirds, third arch is the posterior one-third, and fourth arch is the posterior one. Muscles of the tongue are mostly supplied by 12th nerve, that is the hypoglossal nerve, except palatoglossus. We have already learned. Lymph from tongue drains into all of the following except preauricular. Submental is your anterior, submental is your tip of the tongue, submandibular is your anterior two-thirds right and the left halves, deep cervical is your posterior. Taste from the tongue is carried by all nerves except, the answer is your 11th cranial nerve does not carry any of the taste sensations from the tongue. Sensory fibers from the tongue is carried by all nerves except 8th cranial nerve. So with this, we complete the long answer question of the tongue and few MCQs that we have solved today. So good luck for your exams. Thank you.